Sensitive life and death decisions being made inside our hospitals every single day involving the sickest of COVID patients.
For a family member who can't visit, it can be heartbreaking, frustrating, wondering if everything is really being done to save their loved one. Tonight, ABC 15's Sonu Wasu talks to one family who feels doctors could have done more to save their mom.
The last time I saw my mom was July 24th. And I FaceTimed her, and she was fighting hard on the BiPAP. She was fighting her ass off. I called her and I said, Mom, and I saw the life in her eyes just like fading.
Jason Betyu refuses to look at this video of his mother on a ventilator at Abrazo Arrowhead Hospital in Peoria.
I told her, I said, Mom, you're going to get off this in a week.
Helen Betyu died shortly after this interview with her son Jason. Mixed with heartbreak and grief, Jason tells me he's also fighting frustration and a nagging feeling, wondering if doctors at Abrazo Health really did everything possible to save his mother. The first red flag for Jason? When his aunt, who was admitted into Abrazo Arrowhead on the same day as his mother, was prescribed the promising drug used to treat COVID-19 patients, remdesivir. His mother, however, was denied that drug.
It was outside the therapeutic window of symptoms going more than 7 days.
Hospital policy to administer remdesivir to those within the 7-day therapeutic window of treatment. Jason calls it harsh.
That means they're picking and choosing who lives and who dies. And I know, and I have messages from the infectious disease doctor that she did not agree with that decision. It was Abrazo Arrowhead's administration that made a decision of a 7-day window.
Another hospital policy Jason learned about too late involved the potential life-saving ECMO machines when the Betyu family pleaded with hospital officials to consider their mother as a candidate for ECMO.
They have to be on a ventilator within 7 days to transfer. That's the therapeutic window. Or that's when they say the patient does well.
Too late for Helen. Now Jason questions why hospital officials are not discussing these life and death policies they have with families. We reached out to Abrazo Arrowhead officials with the same question. Hospital officials sent me a statement saying, while they cannot talk about this specific case due to privacy laws, in the case of COVID, our physicians rely on recommendations made by the CDC, FDA, and other expert bodies who have published official guidelines. So to get better insight, we reached out to Dr. Chris Worsham, a pulmonologist and critical care specialist at Harvard Medical School in Boston.
Unfortunately, no matter what happens, when you have limited resources and too many people for the resources you have, some people aren't going to get them.
Dr. Worsham says studies have shown remdesivir is only effective in the early stages of COVID-19. With supplies limited, hospitals may set policies on which patients they feel would benefit most from this drug.
It's always a good idea to tell your patients or their family members about how they do things at this hospital and what they should expect.
Abrazo officials say patient care plans are discussed with families. But Jason tells us the communication did not go far enough.
Communicate to your patients. Be honest with them and find alternative solutions. Don't just say, well, it's COVID and put your shoulders up, because that's exactly how I feel.
Sonu Wasu, ABC 15, Arizona.